Good afternoon, everyone. My name is Nicholas Anthony Garcia. I'm a student at Grand Canyon University. The course I'm currently taking is SWK 545 with Dr. Tabitha. Today I'll be talking about the maternal mortality among black women. This critical discussion is going to be about African American women who are particularly still dying during childbirth at a rate of 3 to 4 times compared to other groups. Potential risk factors include access to health care, racism in the medical field, and social economic features. Today, we'll explore these challenges and identify service gaps and outline an intervention plan to improve outcomes. Service gaps, the absence of specialty community programs aimed at alleviating these disparities. We need to focus use targeted support to reduce the African American maternal mortality rates. We need to ensure that offering and developing healthcare and community based programs use cultural competence. This means specific gaps in the service delivery system that require expensive technology interventions should be highlighted and the outcomes tracked. Community members need to be involved in the interventions that contain and support it. Goals of the intervention: expand and improve the availability of culturally appropriate prenatal and postnatal services. Goal number two: integrate technology responsibly to improve the provisions and delivery of services and communication. Goal number three: develop strategic relationships in order to improve systems that provide direct care to women becoming mothers. Solution for ethical practice involves the use of security when recording data and participants by consent only. Intervention objectives: use case management systems in affairs related to prenatal and perinatal health results. Intervention number two: create the following rules of using the technologies for contingent concerning their bad influence on people's privacy, and absence to their consent. From an ongoing ethical compliance check systems that will regularly access ethical compliance by the organization. Educate all healthcare personnel on topics of implicit bias and cultural sensitivity. Targeting population. Primary focus is going to be on black women that are in childbearing ages and underserved communities. This includes individuals with limited access to affordable healthcare services, access pregnant women at risk due to social, economic, and systemic factors. Intervention designed to align with the unique cultural and social needs of the community. Key components of the intervention: culturally competent health care training for providers, community health workshops on material care and advocacy, use of telehealth platforms to connect with the healthcare professionals. Required resources. Cultural, we need to have staffing that is culturally trained healthcare workers and social workers and data analysis. Funding grants, public health funding, and partnership with NGOs. Case management software, telehealth infrastructure, education materials. We also need to have community collaboration that support local organizations and leaders. Expected outcomes. Black maternal mortality should drop by 20% in 2 years. Better access to culturally competent and equitable healthcare. More community involvement and maternal health care education. We also need to measure through pre and post intervention surveys, data analysis, and track the outcomes. Thank you. This concludes my presentation on the maternal mortality among Black women in the United States.